Welcome! Today, we're tackling a crucial topic, keeping your goats healthy and productive. Across Africa, goats are a lifeline, providing milk, meat, and income. But deadly diseases can wipe out a herd before you even realize there's a problem. This video will reveal the most dangerous goat diseases and, more importantly, how you can prevent them. We'll show you what to watch for, how to act fast, and the best ways to protect your animals. Knowledge is your best defense. Let's make sure your herd thrives, not just survives. Let's get started. Let's delve into a critical threat to goat and sheep farming. Peste des petits ruminants, or PPR. It's a disease so devastating it's often called goat plague. This name isn't an exaggeration. The impact of PPR can be catastrophic for farmers and communities that rely on small ruminants for their livelihoods. This highly contagious viral disease spreads rapidly and can kill up to 90% of an unvaccinated herd. Imagine the devastation, nearly an entire flock wiped out by a single disease. The economic consequences are immense, impacting food security and the livelihoods of countless families. Early signs are crucial to spot. Look for a sudden high fever, often accompanied by a noticeable drop in energy and increased lethargy. The affected animals will appear weak and listless, a stark contrast to their usual active behavior. Another early warning sign is a distinct loss of appetite. Goats that normally eagerly consume their feed will suddenly refuse to eat, showing a lack of interest in food. This is a critical indicator that something is seriously wrong. Pay close attention to their faces. Watch for thick yellow discharge emanating from their eyes and nose. This discharge is a telltale sign of PPR and should prompt immediate action. Examine their mouths carefully for painful sores. These sores can make it difficult and painful for the animals to eat, further contributing to their weakness and decline. As the disease progresses, goats often develop severe pneumonia, making it difficult for them to breathe. You might notice rapid, shallow breaths, coughing, and other signs of respiratory distress. In the later stages, affected animals may exhibit bloody diarrhea, a sign of severe internal damage. PPR is often fatal, if not managed quickly and effectively. The combination of pneumonia and diarrhea can quickly overwhelm the animal's system. The best defense against PPR is a proactive approach: vaccination. Regular vaccination is the most effective way to protect your herd from this devastating disease. PPR vaccines are safe, effective, and provide long-lasting protection for your whole herd. Vaccination not only protects individual animals, but also contributes to herd immunity, preventing the spread of the disease. When introducing new animals to your farm, quarantine them for at least 3 weeks. This isolation period allows you to observe them for any signs of illness before they come into contact with your existing herd. Only after the quarantine period, and if the new animals appear healthy, should you consider mixing them with your established herd. This precaution can prevent the introduction of PPR or other diseases. Limit contact between your goats and other herds whenever possible. Reducing interaction minimizes the risk of disease transmission. Always disinfect equipment and boots thoroughly after visiting other farms or livestock markets. This simple practice can prevent the spread of pathogens from one location to another. If you suspect PPR in any of your animals, immediately separate the sick animals from the rest of the herd. Isolation is crucial to prevent further spread of the disease. Promptly contact your veterinarian or local animal health authorities to report the suspected case and seek guidance on appropriate control measures. Early reporting is essential for containing outbreaks. Unfortunately, there's currently no specific cure for PPR itself. Treatment focuses on managing the symptoms and preventing secondary infections. Supportive care, including providing fluids to combat dehydration, offering soft, palatable food to encourage eating, and administering antibiotics to treat secondary bacterial infections, can significantly improve the chances of recovery. With diligent supportive care, some goats may be able to recover from PPR, although the recovery process can be lengthy and challenging. Remember, fast action and consistent vaccination are your strongest weapons in the fight against PPR. Don't underestimate the power of preventative measures. Don't wait for a disaster to strike. Develop a comprehensive PPR prevention and control plan for your farm. This plan should include vaccination protocols, biosecurity measures, and procedures for early detection and reporting. Protect your goats and you protect your livelihood, your family's well-being, and the economic stability of your community. Healthy goats mean a sustainable future. Stay alert and vigilant and be observant for any sudden changes in your goat's behavior or overall health. Early detection is key to controlling the spread of PPR. Reporting suspected outbreaks not only helps protect your own farm but also contributes to the health and well-being of your entire community. PPR control is a collective effort. With consistent vigilance, proactive preparation, and community collaboration, you can effectively keep PPR at bay and ensure the health and productivity of your goat herd. Next is contagious caprine pleuropneumonia, or CCPP, a deadly bacterial lung infection. It spreads fast in crowded, poorly ventilated conditions, especially in dry regions. Watch for high fever, rapid breathing, painful cough, and weakness. Goats may stretch their necks to breathe. Early antibiotic treatment can save lives, but timing is critical. Vaccination is available and highly recommended in high-risk areas. Prevent overcrowding and ensure good airflow in shelters. Quarantine new arrivals for at least 3 weeks, and monitor for respiratory signs. If CCPP strikes, isolate sick goats and disinfect all equipment. Quick action can mean the difference between losing a few goats and losing your whole herd. Work with your vet to develop a prevention plan. Healthy housing and strict biosecurity are your best defenses. Don't let CCPP catch you off guard. Goat pox, a disease dreaded by goat farmers worldwide, is a viral infection that can have devastating consequences for your herd. It's crucial to understand what goat pox is, how it spreads, and what you can do to protect your animals. Goat pox is characterized by the development of painful skin lesions across the body. These lesions not only cause discomfort to the affected animals, but can also lead to serious economic losses for farmers due to reduced productivity and potential mortality. The disease can spread rapidly through a herd, making early detection and prevention essential. Young goats, with their still developing immune systems, are particularly vulnerable to goat pox. Stressed goats, whether from poor nutrition, transportation, or other underlying health issues, are also at a higher risk of contracting the disease and experiencing more severe symptoms. Protecting these vulnerable populations is key to maintaining a healthy herd. One of the first steps in identifying goat pox is to carefully examine your goats for any signs of the characteristic pox-like nodules. These nodules tend to appear on areas of the body with less hair cover, making them easier to spot. Pay close attention to the muzzle, as this is a common site for the development of these telltale lesions. The eyelids are another area where goat pox lesions frequently appear, sometimes leading to swelling and discharge. Don't forget to check the ears, both inside and out, for any signs of nodule formation. In female goats, the udder is a particularly susceptible area, and lesions here can cause significant pain and discomfort, potentially affecting milk production. And be sure to examine the area under the tail, as lesions in this region can easily go unnoticed. A thorough examination of these key areas is crucial for early detection. Before the appearance of skin lesions, affected goats often exhibit general signs of illness, such as a fever and a noticeable loss of appetite. These early symptoms should raise your suspicion and prompt a closer examination. As the disease progresses, these initial symptoms are followed by the development of characteristic red spots on the skin. These spots eventually transform into raised, scabby nodules that are a hallmark of goat pox. In severe cases of goat pox, the virus can affect internal organs, leading to the formation of lesions in the mouth and lungs. These internal lesions can cause significant complications, including difficulty breathing, starvation due to painful mouth sores, and an increased susceptibility to pneumonia. The goat pox virus is highly contagious and spreads primarily through direct contact between infected and susceptible animals. The virus can also persist in the environment, contaminating bedding, feed, and water sources, which can then serve as a source of infection for other goats. The most effective way to protect your herd from goat pox is through regular vaccination. In areas where goat pox is prevalent, a consistent vaccination program is essential for maintaining herd immunity and preventing outbreaks. Consult with your veterinarian to determine the appropriate vaccination schedule for your goats. Maintaining a clean and hygienic environment is also crucial in preventing the spread of goat pox. Regularly clean and disinfect goat pens, especially after an outbreak, to eliminate the virus from the environment. When introducing new goats to your herd, it's essential to quarantine them for a period of 3 to 4 weeks. This allows you to observe them for any early signs of goat pox or other diseases before they can potentially infect the rest of your animals. Unfortunately, there is currently no specific cure for goat pox. Treatment focuses on providing supportive care to help the affected goats recover. This includes ensuring they have access to clean, comfortable housing and providing them with soft, palatable food that is easy to eat. Good hygiene practices are essential to prevent secondary bacterial infections, which can complicate goat pox cases. In some instances, antibiotics may be necessary to treat these secondary infections, but always consult with your veterinarian before administering any medication. Vigilance is key to controlling goat pox. By staying observant, implementing preventative measures, and acting quickly when you suspect an outbreak, you can protect your herd and minimize the impact of this devastating disease. Internal parasites, especially blood-sucking worms, are a hidden threat that can slowly drain your goat's health. Signs include dull coat, weight loss, weakness, and anemia. Check for pale eyelids using the FAMACHA system. Don't just deworm every goat. Target treatment to those showing symptoms to slow drug resistance. Work with your vet to create a smart deworming schedule. Practice rotational grazing to break the parasite life cycle. Move goats to fresh pasture regularly. Avoid overgrazing and keep pens clean to reduce exposure. Feed hay in raised feeders not on the ground. Always quarantine and deworm new arrivals before adding them to your herd. Bottle jaw, swelling under the jaw, is a warning sign of severe infestation. Strategic management and hygiene are key to keeping parasites under control. Healthy goats mean a healthy farm. Clostridial diseases, a group of bacterial infections, pose a significant threat to goat herds worldwide. These diseases, like enterotoxemia, are caused by toxins produced by Clostridium bacteria, which are commonly found in the soil and in the digestive tracts of animals. Understanding these diseases and implementing effective preventative measures is crucial for maintaining a healthy and productive goat farm. And tetanus, also known as lockjaw, are two of the most concerning clostridial diseases affecting goats. Tetanus, caused by Clostridium tetani, affects the nervous system, leading to muscle stiffness and spasms. Enterotoxemia, on the other hand, is caused by Clostridium perfringens, and results in the rapid production of toxins in the gut. Both of these diseases strike fast and are often fatal, making prevention the cornerstone of any successful goat health management program. The rapid progression of these diseases means that treatment is often ineffective, highlighting the importance of proactive measures. Enterotoxemia is frequently triggered by sudden diet changes, particularly the introduction of rich feeds like grains. This sudden shift in diet creates an environment in the gut that favors the rapid growth of Clostridium perfringens bacteria. Because of their underdeveloped immune systems, healthy kids can die within hours of the onset of enterotoxemia. The speed at which this disease progresses is alarming, and goat farmers must be vigilant in monitoring their animals, especially young ones. Tetanus, in contrast, typically enters through wounds, such as those from castration, disbudding, or even minor cuts and abrasions. The Clostridium tetani bacteria thrive in anaerobic conditions, making deep puncture wounds particularly dangerous. Once established, tetanus releases a potent neurotoxin that causes severe muscle stiffness and lockjaw, making it difficult or impossible for the affected goat to eat or drink. The characteristic sawhorse stance is a telltale sign of tetanus infection. Fortunately, prevention is simple. Vaccinate with the CD and T vaccine, which provides protection against Clostridium perfringens type C and D, the primary causes of enterotoxemia, and Clostridium tetani, the cause of tetanus. It protects against both diseases, offering a cost-effective and reliable way to safeguard your goat herd from these deadly threats. Vaccination is a fundamental aspect of responsible goat ownership. Vaccinate pregnant does a month before kidding, to ensure that their offspring receive protective antibodies through the colostrum, or first milk. This passive immunity is crucial for protecting young kids during their first few weeks of life. Then, vaccinate kids at 4-6 weeks of age, followed by a booster 3-4 weeks later, to stimulate their own immune systems and provide long-lasting protection. Regular booster shots are essential for maintaining immunity throughout the goat's life. Beyond vaccination, avoid sudden feed changes, which can disrupt the delicate balance of the gut microbiome and create an environment conducive to enterotoxemia. Instead, introduce new feeds gradually, over a period of several days or even weeks, allowing the goat's digestive system to adapt. This slow and steady approach minimizes the risk of enterotoxemia. To prevent tetanus, keep wounds clean and disinfected to minimize the risk of Clostridium tetani infection. Prompt and thorough wound care is essential for preventing this debilitating disease. Always use sterile tools for procedures like castration, disbudding, and vaccinations to prevent the introduction of tetanus spores into the body. Sterilization is a simple yet crucial step in preventing tetanus. If a goat is injured and not up to date on vaccines, or if you are unsure of its vaccination status, ask your vet about tetanus antitoxin, which provides immediate short-term protection against tetanus by neutralizing the tetanus toxin. Good nutrition, including a balanced diet with adequate fiber and steady feeding routines, with consistent access to forage and clean water, help maintain a healthy gut microbiome and prevent enterotoxemia. A healthy gut is a resilient gut. Maintaining good hygiene in your goat facilities and implementing a comprehensive vaccination program are your best protection against Clostridial diseases. These practices create a safer environment for your goats. Don't wait for symptoms to appear, as by then, it may be too late to save the affected animal. Prevention is the only way to win against Clostridial diseases and ensure the long-term health and productivity of your goat herd. Work closely with your vet, who can provide tailored advice and guidance based on your specific farm environment and management practices. They can also help you to keep your vaccination schedule on track and address any other health concerns that may arise. Protect your herd by implementing these preventative measures diligently. Taking proactive steps to prevent Clostridial diseases is an investment in the health and well-being of your goats and the success of your farm before disaster strikes. We've covered the major threats to your goats, the common challenges, and how you can fight back against these threats. Remember, vaccination is key, biosecurity is also essential, good nutrition is also very important, and cleanliness are your keys to success in goat farming. Your daily care and vigilance will make all the difference. Share this knowledge and these tips with other farmers. Strong communities protect everyone involved. Subscribe for more helpful tips, and keep your herd healthy, strong, and thriving. Until next time, please stay alert and always take pride in your goats' well-being.